Imagine slowly losing your memories, your ability to think clearly, and your independence. Dementia is a devastating condition that drastically alters the quality of life for millions of people worldwide. It can rob you of your precious memories, disrupt your daily activities, and strain relationships with loved ones. This is why it's very important to understand how we can prevent this debilitating condition, especially when some of the culprits are medications we use every day. Recent studies have shown that dementia isn't an inevitable part of aging. In fact, there are steps we can take to reduce our risk. One shocking revelation from these studies is the strong evidence linking certain popular medications to an increased risk of dementia. In this video, we'll uncover 8 popular medications that have been proven to increase the risk of developing dementia. Stay tuned, because the 8th medication on this list is associated with the highest risk of dementia. You won't want to miss it. Without further ado, let's get started. 1. Pain medications. Opioid painkillers, such as morphine and oxycodone, are often prescribed to treat severe pain, especially after surgeries or in patients with chronic illnesses. These medications act on the central nervous system, providing significant pain relief by binding to specific receptors in the brain and spinal cord. However, besides the risk of dependence, prolonged use of opioids has been associated with negative effects on cognitive health, including an increased risk of developing dementia. A study published in the American Journal of Geriatric Psychiatry reported that chronic pain patients who regularly used opioids were found to have a higher risk of dementia and worse brain health compared to those using non-opioid analgesics. Another study published in the Annals of Internal Medicine tracked patients with long-term opioid use and identified a significant association between prolonged opioid use and an increased risk of dementia. The researchers recommend that doctors carefully weigh the risks and benefits of opioids, particularly for elderly patients. You may be thinking, I don't use opioids, I only use NSAIDs like diclofenac or ibuprofen. I bet those won't increase my susceptibility to dementia. Bad news for you, because even NSAIDs have been shown to significantly increase risk of developing dementia in the elderly population, particularly with heavy use. Please like and subscribe to the channel if you're getting value out of this. 2. Proton pump inhibitors. Proton pump inhibitors, PPIs, such as omeprazole and esomeprazole, are used to treat gastric problems including acid reflux and peptic ulcers. These medications work by reducing acid production in the stomach, providing symptom relief and preventing damage to the esophagus and stomach. However, recent research suggests that prolonged use of PPIs can have negative consequences for cognitive health. Studies indicate that PPIs can interfere with the absorption of essential nutrients, such as vitamin B12 and magnesium, which are critical for brain function. Deficiency of these nutrients can lead to cognitive problems and increase the risk of dementia. Vitamin B12 is essential for maintaining healthy nerve cells and producing DNA and RNA. When the absorption of this vitamin is impaired, it can lead to neurological symptoms, including memory loss and cognitive decline. Magnesium is also crucial for brain health, playing a role in neurotransmitter function and neuroprotection. Low levels of magnesium have been associated with an increased risk of neurodegenerative diseases. A 2023 study published in Journal of American Academy of Neurology reports that popular acid reflux medications known as proton pump inhibitors are associated with a higher risk of dementia. The researchers emphasize the importance of using these medications cautiously and considering less harmful alternatives, especially for elderly patients. 3. Hormonal contraceptives. Hormonal contraceptives, especially combined ones that contain estrogen and progesterone, are widely used to prevent pregnancy and treat other conditions such as menstrual irregularities and acne. While they are effective and convenient, there are growing concerns about the effects of these medications on cognitive health, especially with prolonged use. Studies indicate that hormonal contraceptives can affect brain function in various ways. Sex hormones play a crucial role in neuroprotection and cognitive function. Thus, altering their levels can impact memory and other brain functions. Some research suggests that prolonged use of hormonal contraceptives may be associated with an increased risk of cognitive decline and dementia. A study published in the Journal of Women's Health tracked women with long-term use of hormonal contraceptives and found an association between these medications and a slight decline in cognitive function. Besides, research shows that women using hormonal contraceptives report higher rates of depression, decreased sexual functioning, and greater interest in short-term sexual relationships compared to those who are naturally cycling. And according to a review that combined results from 32 studies, depression is linked to approximately double the risk of developing dementia. So, if you're using hormonal contraceptives, discuss potential risks with your doctor. Alternatives like non-hormonal IUDs, barrier methods, or natural options may be less harmful to cognitive function. 4. Antipsychotic drugs. Antipsychotic drugs, commonly prescribed to manage conditions such as schizophrenia, bipolar disorder, and severe depression, have been associated with an increased risk of developing dementia. These medications control psychotic symptoms like hallucinations and delusions by altering neurotransmitter effects in the brain. However, prolonged use has been linked to a higher risk of dementia. Studies suggest that antipsychotics can cause significant brain side effects, including changes in brain structure and function that lead to cognitive decline. A study in the British Medical Journal followed elderly patients on antipsychotics and found an increased risk of dementia, with prolonged use accelerating cognitive symptoms. This is why, for those requiring antipsychotics, careful medical monitoring is essential to track side effects and adjust dosages as needed. In some cases, it may be possible to lower the dose or switch to a different medication with less impact on cognitive function. 5. Anti-Parkinson's drugs. Anti-Parkinson's drugs are one of the drugs with the highest link to dementia. New research indicates that regular use of certain commonly prescribed medications for bladder conditions, Parkinson's disease, and depression could significantly raise the risk of dementia in later life. The relationship between these drugs and cognitive decline involves complex mechanisms and multiple factors, some of which are directly related to the pharmacological effects of the drugs, while others are connected to the underlying disease and its progression. One key mechanism involves dopamine dysregulation. Anti-Parkinson's drugs, such as levodopa, dopamine agonists, and MAOB inhibitors, work by increasing dopamine levels or mimicking dopamine activity in the brain. While these drugs help alleviate motor symptoms, chronic alteration of dopamine levels can have complex effects on cognition. The brain's dopaminergic system is intricately involved in cognitive processes such as attention, learning, and executive function. Dysregulation of this system, particularly in regions like the prefrontal cortex, can contribute to cognitive decline. Another factor is the potential for neurotoxicity and oxidative stress. Some anti-Parkinson's drugs, especially those that increase dopamine levels, can contribute to oxidative stress. Dopamine metabolism itself generates reactive oxygen species, which can cause oxidative damage to neurons. Over time, increased oxidative stress can lead to neuronal damage and cognitive decline. 6. H2 receptor blockers. H2 receptor blockers and proton pump inhibitors, PPIs, both reduce stomach acid but work differently. H2 receptor blockers, like ranitidine and famotidine, block histamine H2 receptors to reduce acid production, providing relief within an hour that lasts 6 to 12 hours. PPIs, such as omeprazole and esomeprazole, inhibit the proton pump, leading to more significant and longer-lasting acid suppression, often taking a day to start working but lasting up to 24 hours. While H2 blockers are suitable for milder, short-term use, PPIs are more effective for severe conditions and longer-term treatment. A study in the Journal of the American Geriatric Society tracked over 1,000 elderly individuals and found that regular use of H2 receptor blockers was linked to a significantly higher risk of developing dementia. Researchers recommend careful monitoring of long-term use, particularly in older patients. If you use H2 receptor blockers, discussing these risks with your doctor is important. 7. Antiepileptic. Antiepileptic drugs, AEDs, are crucial for managing seizures in individuals with epilepsy, but emerging evidence suggests they may be linked to an increased risk of developing dementia. The mechanisms and pathways underlying this association are multifaceted and involve both direct and indirect effects on brain health. One important way antiepileptic drugs work is by affecting neurotransmitter systems in the brain. Many AEDs change the activity of neurotransmitters like GABA and glutamate to calm down neurons and prevent seizures. However, long-term changes in these neurotransmitter systems can potentially harm cognitive functions. The link between antiepileptic medications and dementia has been proven by many studies, like a recent one by the University of Eastern Finland and the German Center for Neurodegenerative Diseases. Long-term use of antiepileptic medications is associated with a higher risk of Alzheimer's disease and dementia. 8. Anticholinergic antidepressants. This is another class of medications that has been linked with the highest risk of dementia. Anticholinergics are medications used to treat conditions like allergies, urinary incontinence, cold symptoms, and even Parkinson's disease. Examples include diphenhydramine and oxybutynin. They work by blocking acetylcholine, a neurotransmitter important for memory and muscle function. While effective, long-term use of anticholinergics has been linked to a higher risk of dementia. Because acetylcholine is vital for learning and memory, blocking it over time can harm cognitive function. Studies show that regular use of these drugs can negatively affect brain function, especially in older adults. A study by the University of Washington tracked over 3,400 adults for more than 7 years and found that regular use of anticholinergics significantly increased the risk of developing dementia. The study specifically showed that high doses of these medications taken over long periods were linked to a 54% higher risk of dementia. If you regularly take anticholinergics, it's important to talk to your doctor about the potential risks and consider alternative treatments. Many conditions treated by anticholinergics have less harmful options. For instance, nasal corticosteroids can effectively treat allergies without the same cognitive side effects. It is important for patients to consult their doctors before starting or stopping any medication. Discussing the risks and benefits and considering safer alternatives are important for protecting cognitive and overall health. Thank you for watching. Don't forget to subscribe to the channel. Wishing you great health and happiness. See you in the next video.